as we said, this is indirect. Why indirect? Because these tests use antibodies to detect antigen, but you are not really seeing this as antigen, but missing the agglutination in here. That's clear, Christy? Byumvikanye?
Yes.
So we have to competitive ELISA for antigen, where you can have the antibodies and labeled antigen, and you can see whether your labeled antigen remains in the quoted on this, and this is mostly on your reagent site. And you also have the patient's antigen. Beside the labeled antigen, you can also have the patient's antigen. And when you have this, while also having the same kind of antigen, they will make competition to these antibodies. So as antibodies are part of your reagent and the labeled antigen, you know the amount of labeled antigen you put in. And by having these competitive antibodies in patients' serum, you can be able to know as how much your reaction or your sample had as antigen. Kubera ko uzi neza amount ya labeled antigen zawe, uzashobora kumenya whether the reactive or the test material contains also the antigen or not. Uzashobora kumenya niba yari ifite izi antigen cyangwa niba ntazo yari ifite. So you can determine amount of antibodies needed to bind to a known amount of labeled antigen. So this using predetermined amount of labeled antigen and antibodies by adding sample which contains unknown amount of antigen, but not labeled as well, you will reduce the number of labeled. And as they will do competition to bind on the reactive antibodies. So you can be able then to see as this will be fixed on a solid phase, it will not be washed out, while what is remaining or what did not bind on antibodies is washed out. Hari step za washing zikuramo ibintu byose bitabaye bound. Then the concentration is determined from the standard curve using known amount of unlabeled antigen. So you already have the standard curve, and you will plot your reaction or your result on the standard curve to know the concentration of your antigen in the sample. It is very sensitive. It is good. You can know quickly the amount of antigen in the sample. You can also do non-competitive ELISA, where the mean is mostly to detect the antibodies in the patient sample by having a solid phase or immobilized antigen on the on the wall of the reactive, either on plates, wells. Then by adding the serum or the sample of the patient, you can be able to detect whether these have attached on this solid phase, or by adding a labeled anti-immunoglobulin on this reaction. By adding this, you can be able to know whether these have stayed or not. As you do the reaction, you do a step of washing. Iyo umaze gushiramo serum of the patient, you also wash to remove all non-specific bind. Kubera ko izi antibodies nazo zishobora kuguma cyangwa kubindinga kuri antigen, ariko iyo zitari specific to this antigen will just be washed out. And by washing, what is remaining will be specific bind, and can be revealed by adding a labeled anti-immunoglobulin specific to this antibody. And you can be able to see whether this is there or not. And presence of this means presence of this, because this one cannot bind on this. It requires this before binding. It can be quantitative as well. So you can also detect the antigen from the patient serum the same way. Uretse kudetectinga antibody, ushobora no kudetectinga antigen ziri muri serum y'umurwayi, kubera ko ushobora gukoresha noneho antibody. Hariya twakoresheje antigen arizo ziri kuri solid phase, ariko ushobora no gukoresha antibody akaba arizo ushira kuri solid phase. Solid phase turi kuvuga hano ni nko muri, mwese mwabonye plate, ELISA plate. So muri ELISA plate ushobora gushiramo either antibodies cyangwa antigen, then you can be able to test whether the sample has antigen of antigen specific virus or not. Antigen specific virus or not. So the amount of labeled antibodies bound is proportional to the amount of antigen in the sample. So when the sample has more of this, more of labeled antibodies will remain. And as I said, you also wash. You wash here, you wash here to make sure you have specific bind only. This is a plate, a reaction of ELISA, a plate where you can see the change in color. So label that we say over there is more of enzyme, streptovidin enzyme that is bound on the material to make sure the adding of substrate will change color of the reaction. Kenshi muri ELISA have a change of color, and you can either visually read, or most likely you use machine. And in most cases, visually you can see the change in color, and you can read the optic density, each or absorbance of each reaction, which will be proportional to the change in color. And sometimes the change in color means negative or positive, depending on how the reaction have been. So these are some of automated system aho ushiramo samples zawe, ubundi ikabikora byose, igashira muri plate, igakora na essays, then it show you results as well as the estimate amount of antigen or antibody in the serum. There is also some assay based on complements, like complement fixation approach. So antigen are mixed with test serum to be assayed for antibodies. So you first mix antigen and the serum that you suspect having antibodies. So after adding antigen, so you add a standard amount of complements. So if the antibodies are in place, then there will be fixation of complements. So as you add erythrocytes coated with antibodies, if the complement were not fixed, it will completely agglutinate, or we completely hemolyze your erythrocytes. While in case the complement is fixed, thus there will not be a complement to destroy this or to hemolyze these red blood cells. Ni ukuvuga ngo ahangaha absence of hemolysis kandi washizemo antibody na complement biba bivuga ko za antibodies zarimo muri serum yawe uko zafixinze ya complement bituma itakora hemolysis zizi erythrocyte ushizemo nyuma. So you can determine the amount of erythrocyte lysed, and by determining the amount of erythrocyte lysed, you can be able to estimate how much of antibodies were in place or not, as the amount of complement is already known, amount of antigen is already known, so the rest will be the amount of antibodies. So I think this is all for diagnostic of viruses. All these methods are useful in viral detection. Kuri ubu kubera more advances in molecular approach, more is done in molecular biology, like PCR, reverse transcriptase PCR, and detection of viruses is basically done by PCR. But sometimes the viruses, the gold standard, which is cell isolation in permissive cells, is the only way. Kurugero polio confirmation of polio require isolation of cell. Ntabwo bajya bemera iyindi approach yindi na WHO, we only consider isolation of polio as the only way of diagnosing polio. Any question about diagnosing viruses? Any question? Nta kibazo? So if no question,
we didn't get complement fixation. Well, I didn't get what the complete fixation is. I was lost with internet.
Anyone can explain the complement fixation? Harwamusobanurira complement fixation. Fixation, you also want to test whether the serum have specific antibody or not. Do you follow? Then by adding or by mixing antibodies and antigen, of course, if the serum contain antibodies, this will have a reaction, antigen antibody. After adding the antibody to the standard amount of complement is the innate way, but it also works together with antibodies, what is called opsonization. So when the antibodies bind on antigen, the complement can quickly bind on this antibody. While when there is no antigen or antigen antibody reaction, like a complex, the complement will not bind. Hago complement yam binding a kuri antibody itafite antigen, itari complex. So if the complement or the antigen antibody have this complex, the complement will be binding, will be in complex as well. And that is what is called opsonization in immunology, muzabyi. So imaze kuri antigen antibody reaction cyangwa complex bituma itaba free. So by adding erythrocytes also which are coated with antibody, kubera ko complement is very specific, ikiri specific ni antigen na antibody. Complement kubera ko itari specific is binding a free complex ya red blood cells and antibodies. Kubera ko nuyishiramo complementary free, it will bind on directly on. Are you seeing my slide? No?
No.
Sorry. Arenze ko muri kubireba.
Ikibazo.
Uretse gato turangirize uwo muntu uri kubaza cyangwa is it the same person?
No.
Wabashije mbere. Ni ukuvuga ngo dufite antibodies antigen complex. This complex we completely fix the complement, while antibodies alone cannot fix the complement. Then by fixing the complement, because it's a complex antigen antibody and now complement, this is called opsonization, and this is more facilitating phagocytosis, muzabyiga muri immunology. So by fixing this complement, no complement will be free in here. Her complement is free hand. So by adding the red blood cells, erythrocyte coated with antibodies, this is also a complex. This is kind of antigen with antibodies. Iyi complement kubera ko iri fixed already kuri izi antigen. So few of here cannot, will not be, most here will just be lysed. Kubera ko complementary free is a binding a free complex, then we completely destroy this cell. And that is what will happen here. The complement we fix on this, and automatically MRIs the red blood cell. Mu gihe hano kubera ko yari already fixed kuri complex antibody antigen, it will not be available for destroying this. It may be available, but in little amount. That is why you will have to measure or to quantify the amount of erythrocyte lysed to determine the concentration of antibody in your serum or antigens. Is that clear? Uwabajije mbere byumvikanye? Uwabajije mbere yabyumvise? Undi wari ufite ikibazo? The other person who had a question?
I have a question. My question is that we know that the antibodies are specific in their action.
Yeah, loudly, please.
Antibodies are specific in their actions.
Mm-hmm.
So, suppose someone is suffering from COVID-19, and ugashyiramo antibodies, antigens hano zo za influenza virus, kandi arwaye COVID-19,
ukazishyira he?
nyine ugiye kuzishyira nko muri sample, ugiye kuzishyiramo nko muri sample,
ugiye gukora complement fixation test.
Yeah,
it will not react. So the first reaction, we need to be specific. Kubera ko antigen igomba kuba specific kuri antibody.
Yeah.
Yes.
No, se ubwo ngubwo uzabwirwa n'iki antigen ziri bushyiremo kugira ngo ukore fixation?
Yes, no kuvuga ngo mbere yuko ukora test, sibyo? No kuvuga ngo mbere yuko ukora test, uba ufite icyo ugiye gupima. Urabyumva? Niyo yaba PCR, niyo yaba ELISA, sibyo? ELISA, either ugiye gukora ELISA ya HIV, ugiye gukora ELISA ya measles, ugiye gukora ELISA ya rubella. No kuvuga ngo icyo kintu ugiye gupima, sibyo? Ukoresha specific antigen zacyo. Do you follow?
Yes,
so you don't test in black. Ntago uhera ku busa. Ubuzi icyo suspecting. Ikibazo ufite?
Igihe suspecting ikintu ugasanga wenda urimo gususpecting influenza, nyamara someone is suffering from COVID-19, kandi some symptoms zijya gusa sometimes.
Yes,
influenza.
Uzasanga influenza yawe ibaye negative. Specific pathogen ntabwo ibiri negative ku bintu byose. Nakuvuga niba ibaye negative kuri influenza, it doesn't exclude COVID-19. Do you follow? Ni kimwe nuko bamutestinga for COVID-19, sibyo? Iyo bamutestinga akaba negative for COVID-19, it doesn't exclude ko afite influenza. Do you follow? nucleic acid za influenza, za COVID-19, iza adenovirus, iza paravirus. Ni ukuvuga ngo ukabikorera icyarimwe muri reaction imwe.
Okay.
With multiple target ushobora kumenya ngo uyu muntu ntafite COVID-19 ahubwo afite influenza. Do you follow?
Yes.
Ariko izo teste tuzikora for like let's say a throat swab. A throat swab by protocol ushobora gukoresha multiplex PCR kugira ngo umenye niba ari influenza, niba ari corona, niba ari indi respiratory syncytial virus, for example. By doing that, you can be able to say that. But if you are doing this kind of tests, uri gukora ikintu kiri specific kuri pathogen runaka. Iyo uyibuze, sibyo? Iyo uyibuze ntago bye excluding izindi. Complement fixation is a specific test. Ntago wagiramo multiplex. Ntago wagira antigen.
Igihe multiplex zanze se wodarinze wenda ikizami cya specific virus runaka ugasanga iri negative, urongera ukodaringa ikindi nacyo cyakwa nko kongera ukodaringa ikindi, cyangwa ibyo ndaringira rimwe bakabikorera rimwe byarangira nyine ukabona.
It all depends. Ku rugero nk'ubu ngubu ubu turi muri COVID-19, sibyo? Umuganga ntabwo azajya gusaba ngo multiplex, nta nubwo mwe mujya musaba multiplex what, sibyo? Uravuga ngo ibyo suspectinga ni ABCD, ugasaba ko bakora diagnosis y'ibyo bintu, sibyo? Ni ukuvuga ngo
yes,
by just defining your clinical diagnosis ushiramo possible cause, sibyo? Muri izo possible cause bitewe na test zihari, availability of test, barashobora gukoresha multiplex, sibyo? Cyangwa bagakoresha specific kit. Specific kit ikoreshwa igihe umuganga suspectinga ikintu kimwe. Iyo umuganga suspectinga byinshi binyuranye, niyo multiplex ikabihari niyo ikoreshwa. So you do clinical diagnosis, then laboratory gakora confirmation among your differential diagnosis.
Okay. Yeah.
Sibyo?
Yes.
No kuvuga ngo iyo nk'ubu mu gihe cya COVID ntago ntekereza ko influenza ntabwo yahagaze. Do you follow? Like
yes.
United States ntabwo bigeze batestinga for influenza, batestinze for COVID. Ntibabona kaza influenza. Ejo bundi baza gusanga test bakoresheje na case za influenza yazitaga COVID-19. So meaning that the test was also faulty.
Yes.
So iyo already hari pandemic cyangwa ikintu umuganga atekereza cyane cyangwa clinician areba cyane, most likely the laboratory will be directed to that pathogen. It will be only COVID-19. Nk'ubu kuri lab, National Defense Lab, ntabwo ntekereza ko tukibona samples za influenza. Although influenza did not stop, but we don't, because it's overridden by COVID-19. Any other question? Ndabona hari hands. Is a question or not? If no question, can we have a break of let's say 10 minutes and come back at 11? Tugira iminota 10 ya break, tugaruke muri class 11 turebe ikindi kintu dusomaho mbere y'uko muzakora ya reading yanyu yo kuwa mbere no kuwa dusipoza ko izakavaringa hafi ya byose ku buryo we only take time for questions and the discussion. Hari ufite ikibazo ngo tugisubize mbere yo kujya muri break? If no question, let's have a break of 10 minutes. We meet at 11 again. See you.